Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. This week we hear from Kevin Wehner and Scott Miniea. They both work at nonprofit organizations that help people enroll in health insurance and navigate the healthcare system. They spoke about some of the challenges that often come up during meetings with clients and what it's like to help Missourians find health insurance. Here's Kevin.
Well, there's this thing called the Medicaid gap. I remember
that's what I was going to say too.
Yeah, I think during the first open enrollment period began in 2013, and the Affordable Care Act was really in the news a lot at that time because the website wasn't working so well. And I think a lot of people had the impression that just anybody could get health insurance, and that's not quite true. So you have this situation where people don't earn enough money to qualify for financial assistance, but their income isn't low enough to qualify for Medicaid.
The Medicaid gap is the least logical thing to explain to someone. You mean I don't make enough money to get money for free health insurance? I have to pay full price because I make $10,000 a year instead of $12,000 or $13,000 a year. Mm-hmm. It's obviously people are shaking their heads and wondering, why is the system the way it is? And, it is what it is. And our role is never to have take a political stance towards it or anything of that nature. But it is frustrating when you see people who are coming in and they're doing the things that they believe they're supposed to do and not always able to get the help they need. So we have a pretty extensive list of options to look through with them.
I've had people cry.
Mm-hmm.
And, what can you do? You can just kind of listen and kind of let them. Yeah, it's tough.
Yeah, unfortunately, we aren't able to provide the answers for everybody. Yeah. But the nice thing is the people that we can help tend to be surprised at how much we're able to help them maximize the things they're entitled to, based on their age or income or whatever, depending on the program we're talking about.
Well, and during the first open enrollment period, when the website, healthcare.gov, wasn't working very well, a lot of times we'd have to meet with a consumer 3 or 4 times before we'd finally get them all the way through the application and enrolled in a health insurance plan. But I wasn't about to give up with anybody. I was, stick with them through until it's done.
We can't always fix everything, but we can certainly make sure you're understanding what your options are. And I answer a lot of questions and, help make sure that the program is running the way it's supposed to and that we're serving Missourians with their healthcare needs. That's kind of what it's about. And there are lots of pieces to that.
There's a lot of misconceptions about the Affordable Care Act. A lot of it's around politics. And I think a lot of people, they don't check it out maybe because maybe their neighbor got a plan with a really high premium or high deductible. But it's so individualistic. It's based on your family income, not your neighbor's family income. So I would just encourage everybody to check it out. If you need health insurance.
Well, and the same thing, we have the annual enrollment period comes up and people are like, well, I'm good with what I've got. Well, plans change every year. Yeah. Your health changes every year. What medications you're on might change every year. And what they don't realize is as long as there's assistance available to you and it's free, why not take a look?
That was Kevin Wehner and Scott Miniea speaking about the challenges and triumphs of helping Missourians enroll in health insurance. That's it for this week's Missouri Health Talks, which was reported and produced by Reagan Houston. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.